Hi, everyone. My name is Tina Chai. I'm a fourth-year medical student at Vanderbilt, and the project I'm sharing today is increasing clinical trials access for Black women with breast cancer through patient navigation and community education programs. And this project is made possible by our collaboration with several talented doctors like Dr. Reed, Dr. Powell, as well as our clinical trials team, including Emma Shrimp, Clarissa Campbell, Meredith Smalls, Courtney Thomas, and of course, my mentor, Dr. Deborah Friedman. So, a little bit about why we are studying this. We know that the positive impact of clinical trials is clear in breast cancer. In fact, recent therapies made possible by clinical trials have offered patients initially non-responsive to standard treatments a second chance at life, bringing the 5-year survival rate of primary breast cancer up to an astounding 91%. However, although white women are more likely to be diagnosed with breast cancer, Black women are 40% more likely to die of breast cancer. And we can really see this here in Figure 1, where the most common cancer deaths for white women is lung, with breast now moved down to 2. However, in Black women, breast is still the leading cancer death, and lung is number 2. And so we also know that while Black women represent 12% of breast cancer cases in the US, they comprise 3% of participants in clinical trials. Additionally, Black individuals are less aware of clinical trials and face greater barriers to accessing them. So, knowing that there is a lower enrollment rate of Black women in clinical trials and that there is a greater mortality rate of Black women with breast cancer, we wanted to really target this issue. And so the objective of our study is to address the barriers to access and participation in clinical trials for Black women with breast cancer. And the way that we're doing this is by assigning every single Black woman who enters Vanderbilt Ingram Cancer Care with a patient navigator. And so these patient navigators are non-clinically trained individuals who are prepared to assist patients throughout their cancer course, acting as a confidant, helping serve in case manager type tasks too, to make sure that they have the best type of support throughout their cancer journey. So we're studying the impact of patient navigation, as well as in another arm, community education events on clinical trials knowledge. So first, I will talk about our patient navigation arm of the project, followed by the community education arm. So we have started this pilot study since the end of February of this year and have been able to assign 42 Black women with breast cancer with patient navigators. This is roughly what the demographics look like. Most of our patients are above the age of 50. Most of them have private insurance, though some do have public insurance. It's pretty close, but most have college education. And most of these diagnoses are invasive cancers at an early stage, and most of them are new or non-recurrent cancer. So we provide all of our patients with a needs assessment as well as another assessment regarding their patient navigation experience and clinical trials knowledge. So here is our needs assessment where there are 5 buckets of needs, as well as in non-bolded font, the most indicated need within each of the 5 categories. Notably, within the patient education category, we see that information about clinical trials is the most indicated need by our patients. Similarly, in our financial category, we see that the most indicated need is resources to pay for medical bills. With transportation, it's money to pay for gas. With emotional, it's support groups. And with wellness services, it's fitness and exercise. And then down here, we see the survey responses that patients filled out regarding their navigation experience. So we learned that patients who were assigned a navigator, 91% said that they learned new information about their personal cancer experience from patient navigation. 91% said that their PN improved their overall cancer care experience, and 100% of these Black women with breast cancer would recommend patient navigations to other people. With regards to clinical trials knowledge, 77% said that before patient navigation, they knew very little to nothing about clinical trials, but following navigation, they said that they were able to get more information and resources about clinical trials. So overall, we see that the patients who've been assigned a PN so far have enjoyed their experience with the PN, who have added to their cancer care journey. Now I'll talk a little bit about our community education arm. So essentially what we're doing here is a Black woman physician will go into communities in Nashville where there tend to be more minority patients residing there, and will provide an informal lecture about clinical trials. And so this is what our brochure looks like, the title and the table of contents. And within our brochure, we also provide a QR code to a video that offers more educational materials about clinical trials for patients. And this brochure is offered to every single patient at Vanderbilt Ingram, as well as every single patient who attends these community education events about clinical trials. And we also do a survey at these community education events to learn about the barriers to access that these patients and communities may face. And we also learn about their perceptions about clinical trials currently. So far, we've learned that 100% believe that the benefit of clinical trials research is access to new treatments before they're available. We've learned that 95% believe that the reason why minority groups may not participate in clinical trials is due to mistrust, being uninformed, and being uninsured. We learned that 92% of patients did feel like their patient rights were protected within clinical trials due to the IRB. And we learned that about 80% of patients post the education event were actually willing to participate in clinical trials themselves. So overall, we've learned that across all survey questions, most patients have had patient navigation experiences beneficial to their cancer care. Most patients reported knowing more about clinical trials after patient navigation and that they would share this information with other people. We learned from community education events that patients report mistrust, being uninformed, and being uninsured as the main reasons why other people like themselves may not be participating in clinical trials. And so we really want to continue accrual and to study the impact of patient navigation on whether or not it can actually increase enrollment rates of Black women with breast cancer within clinical trials at Vanderbilt Ingram. So we're excited to continue this study, and kind of big picture for the future goals of this study is that we really want to increase equity and make sure that all people are able to access the awesome treatments that have allowed the survival rate of breast cancer to be so high. And we hope that this study can serve as a model for the use of patient navigation across other diseases to hopefully increase clinical trial access for minority patients. I really like to thank Dr. Deborah Friedman, my mentor, as well as the MVTCP for funding my project.